Hello and welcome to our podcast series, Conversations with KidsPeace. I'm Bob Martin, coming to you from an appropriately socially distant location, again, as KidsPeace, as so many of us are dealing with the issues of the COVID-19 crisis. Today we want to talk about a program that KidsPeace has had for several years, but like many of our programs, it's becoming particularly relevant now that we're dealing with this crisis across the entire society. The need for help for kids who are facing mental and behavioral health services is great all the time. But it's obviously particularly acute when we're talking about widespread crises like COVID-19. And when you add in the fact that many parents, families, individuals may have at this time concerns about having their situations addressed without being having it be necessary to take advantage of hospital emergency room resources, for example, it becomes a very tricky situation for folks who are facing that right now. There's a program that we have had, as I said, for a couple of years, available in the Lehigh Valley and Monroe County in Pennsylvania, that is the kind of thing that can help those families deal with all of those issues. And to talk about it, we're very pleased to welcome Harvie Oliver. He's the program manager for PA Outpatient Services at KidsPeace. Harvie, thank you. I hope you're staying safe.
Yes, absolutely. Thank you, Bob, for having me today. It's rough times right now we're in, but we're safe.
Excellent. Well, that's good to hear. Good to hear. So what I'm talking about today is a program that is essentially providing free assessments without an appointment, free what we call walk-ins, for folks who are facing some sort of mental or behavioral health crisis. So if you can begin by talking a little bit about the example, some examples of the situations that prompt someone to need to take advantage of this program. What are the kind of things that they or their family member is experiencing?
Yeah, for sure. So, if someone is in crisis, is the basis for what we say. And somebody's crisis is relevant to them and what they consider a crisis. A lot of times we see individuals who are having depression. Right now, anxiety is very high, as you previously mentioned. And they're coming to us because they need some support and to cope and deal with their situations. Other times it can be much more acute situations that we see where individuals may not be safe in the community. And we are, one great thing about our walk-ins is that we provide access to that treatment. And for families who don't know what they need, but they need help, they come to us.
Yes. So let's say someone does come in for an assessment. What can they expect? Well, what happens during one of these sessions?
Yeah, they're going to meet with a master's level clinician. We're going to sit down with them and really just do a crisis level care assessment. We're really just trying to determine the acuity level and what would be appropriate level of care for the individual. Sometimes people come in and we don't recommend any level of care, but most of the time, outpatient. Sometimes they may need various levels of care, partial programs, and sometimes even need to be hospitalized if they're not safe in the community. We'll make those recommendations. And what's really cool about our walk-ins is 96% of the individuals who walk in come out with an assessment, a recommendation, and get connected to some type of mental health treatment.
Certainly, I think by the time that they've gotten to the point that they're actually going and talking to someone like yourself, it's really that they are really in need of these services that you're recommending.
Yes.
So my understanding is that you'll come up with what we call a safety plan.
Yes.
For that term. What are some of the elements of that in addition to the recommendation?
Yeah, after we make the recommendation for individuals, we don't want them to leave us without ensuring that they're safe. So we'll create a safety plan that really identifies three different things. One is what type of supports that they can do to help manage their crisis on their own. We identify particular individuals who may be able to provide a support to them, and so they have that contact information available and ready. And we also try to make sure we connect them to, very other resources like crisis, make sure that they have the 24-hour crisis line. We provide them with our Teen Central website and other resources that may be available to them between the time that they leave us and they go home before they get access to the care they need.
And certainly, this is of great value to that individual, of course.
Sure.
But I think what's really interesting right now is that it's also a bit of a benefit for the healthcare system in general, right?
Oh, absolutely. Well, for the individuals who have the higher acuity, higher level of care that may be needed, like a hospitalization, we can divert individuals from the emergency room. Many people right now are very, very hesitant to go to the emergency room unless absolutely necessary, especially during this COVID crisis. And even prior to the COVID crisis, just the fact that if you've ever been in the system, it could be, you can sit at the ER for hours upon hours before they determine and are able to get you access to hospital. So what we've been able to do, even before the COVID crisis and now, to do the level of care assessment. If there is a child who, meets the level of care for hospitalization, and we have the direct access to our hospital to determine if to directly admit and support that process. A lot of times, if we have the space and availability, we can get them right in. And again, don't send them to a place where they're dealing with other big issues such as the COVID crisis and so forth.
Roughly how many assessments, like in the past year, has been done?
Yeah.
We should point out that they're done at our offices in Allentown. We have 2 offices there at our Family Center office, which is, I guess the address is
Fountain Hill.
It's technically in the borough of Fountain Hill. I want to make sure the Fountain Hill people understand I'm not trying to, denigrate their fine community. And also in Mount Pocono up in Monroe County. So how many do we usually do a year?
Last year, 2019 was our largest year. We had about almost 1,000, 975 walk-in assessments that we completed last year. We started in 2013. I think since then, we probably we're getting close to about 5,000 we have totally done since we implemented this service.
Any idea, since the COVID-19 crisis sort of emerged, probably 4-6 weeks or whatever, any idea how that's going with the number of assessments you're doing?
Sure. One thing that we are seeing is that people don't want to come out. So although walk-ins have reduced in numbers over recently, what we have seen is acuity. The ones who are coming out and getting access, actually the acuity has been higher. So the sheer number of people avoiding treatment altogether, we are seeing a decline currently in those walk-ins. However, we do have staff that are readily available to meet them face-to-face at all of our locations during this crisis. All of our offices are open. As well as we're utilizing telehealth.
Yes, and we should point out, we're screening the folks that come to the offices. All the offices are open for their regular hours.
Correct.
But you mentioned telehealth. So how does that work if folks feel like they need help, but they are symptomatic or they're just concerned about going out, as you said? How can they access the program?
Well, normally on the base, they can always. Well, let me start off by saying they can walk into any of our locations at any time. When someone comes into any of our buildings, we have a thermometer. We're going to be taking a temperature, as well as assessing them to make sure that they haven't had a temperature and other issues regarding COVID, to make sure we don't continue to that we reduce the opportunity for infection. So that's the first thing that we're doing. However, if what we would like to encourage individuals to do is to give us a call in, and we can do the quick assessment for COVID on the phone. We can also assess for acuity and really determine if we have opportunity to do a direct admit to the hospital, if it's going to be necessary ahead of time so we can really minimize individuals' stay, if we avoid the hospital if necessary, or just really maximize their time and get them the treatment they need quickly if necessary.
Right. So I rattled off some quick locations, but let's slow down a little bit, and we'll say the assessments are available where when?
Sure. We, like you said, we have 2 offices in Allentown. One is at St. Luke's at Sacred Heart. It's 451 Chew Street, Suite 105. We also have an office at Green Street, which is across the street from Tariff High School. It's 801 East Green Street. And that was our 2 Allentown locations. In Bethlehem, like I said, we're in Fountain Hill, which is 1620 Broadway in Bethlehem, in our CDTRC building. You could just walk right in and they'll see you there. And last but not least, in Mount Pocono, 1151 Pocono Boulevard, we're available as well. And we're available for walk-ins 9 to 5.
9 to 5. That's fantastic.
Yeah.
I also want to give a big shout out, Harvie, to you and your staff. You, like so many folks in healthcare, you're on the front lines. We really appreciate what you're doing. And I know that families who are going to face this, and they're probably sitting there saying, on top of everything I have to deal with coronavirus, now I have to face this issue with my family. I have to believe that it's a godsend to have that capability. So thank you, and thanks for all the folks out there.
Absolutely. I would add, just if they don't remember those addresses, they can call us at 610-799-8600. That is our family center. Our staff can direct them to the closest location if you need that support to get you treatment. So you can just give us a call at that number. We can kind of get you in the right direction. And
we also want to point out that at our website, kidspeace.org, we have a special page for coronavirus response, and we have all this information that we've talked about is there. You can go there, or you can call 610-799-8600. But the help is there. Go get it.
Yes.
Come get it. We're sort of thing.
Absolutely.
Harvie, you know the score. You've been on with us before. We close all of our podcasts with asking you for a life hack. Certainly this kind of time where we need all the life hacks we can get. So what's your life hack for us today?
Well, it's just more of a quote. It's a simple quote that I thought about today, and especially in going through everything that we're going through. And teamwork makes the dream work. It's real simple. Together we can really come together and provide the support and needs of the people who need our help. That's what we're here to do. We're in it through the long haul, and teamwork makes the dream work.
And teamwork makes the dream work across all of everything we're doing. People who are staying home, taking care of themselves, and of course the essential workers like yourself who are out here keeping the lights on, keeping the society going. And we thank you very much for that. Harvie Oliver is Program Manager of Pennsylvania Outpatient Services with KidsPeace. Thank you again. I want to mention that Harvie mentioned a service that we've talked about in the past, which of course is Teen Central. If you've got a teen or a young person who are, because of the closures, the school ending, that sort of thing, maybe cut off from their friends or their social supports, it's a web-based, free, anonymous, confidential service that they can go on. They can get information, they can get advice, they can get encouragement, and they can put their own story in and get a therapeutic support response in return. So we invite you to do that, and that, of course, is at teensentral.com. The KidsPeace, the Conversations with KidsPeace podcast usually is produced by my friend Robbie Allred, but I'm doing it here, so if there's mistakes, it's not his fault, it's mine. That's why I'm mentioning it. I am Bob Martin. Thank you for joining us. We look forward to having you join us again for more Conversations with KidsPeace. Stay safe and take care.